Just a little bit of background on Infant. So we're a translational research centre based predominantly in UCC and Cork University Hospital, focused on delivering innovations, translating our research innovations to clinical use, to bedside and cotside, mainly to the research domains of diagnostics, nutrition, connected health, therapeutics, clinical trials, devices. We do some epidemiology, physiological monitoring also. We were launched in 2013, but that was based already on a decade of collaborative research. We've grown quite rapidly. We've got some good scale now. Because we're translational focused, we've got over 30 industry partners to help us to bring innovations into clinical use. We're lucky that we're based at Cork University Hospital in CUMH, where we have access, I suppose, to over 8,000 deliveries per year, which is very important in terms of our various studies. We've had some success so far in newborn seizure detection algorithms, screening tests for preeclampsia, early blood biomarkers of brain injury newborns, and immunotherapy for peanut allergy just recently. So our PIs, or investigators, are mainly from UCC, but also from Trinity, from RCSI, and NUI Galway, in the areas of pediatrics, neonatology, obstetrics, engineering, health information systems, etc., neuroscience. Okay, well, why do we exist? Because I guess everyone here is aware of these kind of stats. Because there's still persistently high levels of maternal death, of stillbirth, of neonatal death, because of the global health burden of perinatal disease, because of the, I suppose, huge underinvestment in research in this area by industry and funding agencies, and because of the potential of equitable perinatal research to avert significantly the global disease burden. And of course, this morbidity and mortality is predominantly experienced in low resource settings, which is why we wanted to partner with a hospital-based research facility in a low resource setting to work with us to ensure that we translate our innovations to the kind of settings where they're most needed. So the Kilimanjaro Clinical Research Institute is founded in 2009. It's already internationally recognized research institute. It's integrated into the medical setting at KCMC, so a bit like ourselves, and the Tanzanian health system. They are quite well established in terms of clinical trials, vaccine trials, etc., for infectious diseases, and they have lots of collaborations with universities, particularly in the United States, and not so much, so they're very, very well resourced and equipped in that area, not so well in the perinatal research area. So I guess the mission of our partnership with them is so that we can jointly adapt innovations to low resource settings. We can, through knowledge exchange, through mutual capacity building, and through collaborative research. KCMC, the tertiary referral hospital on the same campus, has 5,000 deliveries annually, has a high percentage of neonatal deaths from birth asphyxia, prevalent preeclampsia. In contrast, I guess, to KCRI's resources, it's resource constrained, and it's particularly evident in its maternity wards as neonatal units, which is over capacity, lacks ventilation capacity, CPAP, no biomedical engineering backups. That has a lot of challenges, and that's a feature of our partnership to work to address those. So thanks to the ESTHER partnership funding, and we had made this link prior to ESTHER, but this really helped us to strengthen the partnership, to develop an MOU, to travel down there to finalise and sign off that MOU, to kick off some collaboration on a really, really valuable KCMC birth registry, which I'll go into more detail in a second, and a neonatal care collaboration. And also it has critically enabled a return trip of our colleagues from Moshi to come to Cork, to develop new areas of cooperation on student and staff exchange, to get buy-in at all levels in university, including from the UCC's president, to present and to meet colleagues at CUH, to progress joint funding applications to Horizon 2020, Saving Lives at Birth. Okay, so just the birth registry was an initial project we decided to collaborate on because somewhat uniquely, certainly in Tanzania and in many countries in Africa, they have a very, very detailed birth registry with over 60,000 births recorded with clinical socioeconomic data. And of course, this is vital information for healthcare providers, funders, policymakers. It's key to local, robust, accurate prediction of adverse pregnancy and natal outcomes. But it's very, very much, it's a paper-based system currently, which is transcribed then into Microsoft Access, is very, very underutilized in terms of data mining for research, in terms of clinical decision making. So one of our first collaborations was to enhance this registry to make it electronic based, and so the data is entered electronically and it is into a web-based birth registry, which has all sorts of potential in terms of data mining, in terms of efficiencies created in terms of data entry, less reliance on human resources in terms of data entry, and everything can be done much more real time. So that is developed. We're at the piloting phase. So we're in our upcoming trip in February. We'll be rolling this out in conjunction with the IT manager down there. It's already been piloted by pediatricians and obstetricians themselves, and we're tweaking the system as we speak. And we've jointly developed a new birth registry data dictionary, which will be critical in terms of a real potential for this project is to link in with other birth registries internationally and to enable us to do comparative studies. Okay. The INVEST program is another aspect of our collaboration, and that's been enabled by one of our own industry partners who have set up a charity to help us to invest in the under-resourced neonatal unit at KCMC. So jointly we're working to improve newborn care and respiratory support there. We've already transferred equipment to this end, bubble CPAP machines, resuscitation equipment, oxygen concentrators, etc. And also, this program is enabling, student and clinical exchange. So we're jointly supervising a pediatric resident at KCMC to undertake a PhD in UCC in the efficacy of kangaroo care for premature babies. Other joint projects that we're discussing, and that we're, discussing / applying for funding to international agencies, are a mobile newborn brain health scanner to help as a decision support tool for clinicians to detect and to grade brain injury, to make some of the screening tests we developed for preeclampsia robust and appropriate to resource-limited settings, not just at KCMC, which is located in the city, but in more rural clinics as well, and to do the same thing for brain injury biomarkers. So the focus for 2019 is strengthening the partnership, and thanks to an ESTHER grant, we'll be making a visit in February where our director will visit again to cement partnerships. We'll work on the mutual capacity building, clinical comments, undergrad and postgraduate exchanges. We see big potential in that, and they're very interested in that. Because this will ensure a steady flow of researchers to collaborate into the future. It will broaden the base of the collaboration. And we'll be bringing one of our PIs, who's a consultant neonatologist, down to help advance collaboration in neonatal or preterm research. And then there'll be a return visit later in 2019 of our colleagues there, including the Provost of Academic Affairs, to assess our capacity and to work on the undergrad and postgrad exchanges. And we hope all of this will help us to further develop our foundation to become full ESTHER Island partners. So thank you again for your support.